ago, the COVID-19 pandemic changed the world as we know it. So many things are different, from healthcare operations to education to the economy.
But also attitudes toward vaccines in our country. I spoke to experts about what has changed and what healthcare workers have learned. In the beginning of the pandemic in 2020,
oh, it was brutal.
Uncertainty reigned supreme. Here's Dr. Andrew Jameson, the section chief of infectious disease at Trinity Health Grand Rapids.
I've never been involved in any kind of patient care situation where so many people that I laid hands on that we were trying to help, no matter what, didn't make it.
By the start of 2021, a new tool to combat the deadly disease came into production, the COVID-19 vaccine.
The rapidity with which it came out, I mean, it was just remarkable.
Early in the pandemic, a federal effort called Operation Warp Speed supported multiple COVID-19 vaccine developments. But the work began many years before.
Warp Speed was based on 50 years of really good basic research on studying coronaviruses and studying mRNA.
By March of 2025, more than 711 million COVID-19 vaccine doses have been administered in the U.S. 70% of Americans completed the primary series of vaccines, according to the World Health Organization.
And we had this tool that helped prevent death. I mean, that's flat out, that's what it did. And it changed everything. It changed the tide of COVID.
But soon, the narrative surrounding vaccines began to change.
A lot of these tools just weren't accepted, and I don't know that any of us really expected that.
Vaccine hesitancy or vaccine resistance grew, not only for the COVID-19 vaccine, but also on childhood vaccinations and flu shots. There was nearly a 10% decrease in childhood vaccination rates since 2019 in Michigan.
I think the problem that's happening is that misinformation is running through the veins of all Americans. And so we really have to be vigilant about dispelling some of the myths that are out there.
In February, an unvaccinated child died of the measles in Texas. It was the first death in the U.S. from the preventable respiratory disease since 2015.
So I don't think you can overemphasize both the safety and the effectiveness of vaccines. I'm sorry people don't feel that way.
Now, healthcare providers are examining how vaccine messaging could be different.
You know, I used to get frustrated when people were hesitant about vaccines, and that's gone away. It's really trying to be a positive partner for my patients and people that I come in contact with.
It really can't be this safe and effective message over and over and over again. There is a group of people that I don't think that approach is going to ever be effective with.
So we should encourage very strongly, but we shouldn't take this authoritative stance that we know better than you. You just need to do this.
Different messages for different people in different contexts.
There's a push for more conversational vaccine discussion with your doctor. Meanwhile, Dr. Jameson urges against believing everything you read online.
I don't want to go back into a world where we have polio circulating, where we have measles circulating, where we have these diseases that killed thousands of kids a year, and being okay with that.
The pandemic not only changed the attitude for many on vaccines, healthcare operations are also different since 2020. I dive into that topic during a COVID 5 Year Later special. We'll have more stories on topics ranging from education to memorials Thursday at 5:30.